My name is Lisa Garrett, and I am the Director of Personnel for the County of Los Angeles. In May, we celebrated Older Americans Month. Well, DHR wanted to capitalize on that and celebrate some of the older Americans within our own county workforce. As you know, we have 115,000 employees, some who are in the baby boomers and also the traditionalist generation. And one of our older Americans within our workforce is our own Dr. Luciano Barajas. Dr. Barajas is one of the head pathologists in the Department of Health Services, and at specifically Harbor UCLA Medical Center. Dr. Barajas, thank you so much for joining us today. I'm so excited to have you here. Now, tell us how long you have worked for the county.
Well, I joined Harbor UCLA. In those days, it was called Harbor General.
Yes.
In 1974.
Mm-hmm. Where did you came from? Spain?
I was born and raised in the Canary Islands, Spain, in the city of Santa Cruz de Tenerife. I went to school there in high school. And from there, I moved to Madrid to medical school. Okay. And from there to the United States. I decided that I would like to have as much training as possible in as good a place as I could get. I took an internship in the East Coast. And then I moved to St. Louis, Missouri, to Washington University Barnes Hospital, where I completed my training. Mm-hmm. And when I was in the second year or so, the gentleman came and I was introduced to him, was the chairman of the Department of Pathology at UCLA.
Okay.
And he was recruiting young people. And I don't know if they wanted to get rid of me or they thought I was ready, but to make a long story short, I accepted, and we, my wife and I and a little baby, moved to Los Angeles. So I came to UCLA as an instructor, and I spent like 13 years or so at UCLA campus in Westwood, and I became a professor, tenured professor. After I just received this position, this promotion, I was offered to go to Harbor. And
you've been there ever since?
And I have been there ever since.
And how long is that? 50 years?
50 years.
Congratulations.
Thank you very much.
50 years. Now, I know you were talking about how they recruited you, but what made you want to pursue a career in public service?
Well, my father was a doctor. We live in the second floor, and my father had his practice in the first floor. So ever since I remember, when I went to school, I could see the patients waiting for my father. This is in the 30s and 40s, in the 40s, early 40s. And he believed in practice. He never refused a patient because he couldn't pay. He accepted everyone that came to him for help.
Now, in 50 years working for the county, I'm sure you have seen a lot. What kind of changes have you seen over the years within the county in the last 50 years?
There have been significant changes in the hospital, in the county, I'm sure, as well. But the arrival of the women to the healthcare in general, and our hospital in particular, has been very, very important, very major. And the beauty of it is that they are present and occupy positions at all levels.
I love that. And even the department head.
Department head,
yes.
the CEO,
yes.
name and they are, and also in all specialties. Because at the old days, there were some women in medicine, in pediatrics, and in obstetrics and gynecology. But now you have them in surgery, pathology. It's lots of women, mainly women. We just hired 5 residents. All of them were women. So it was not on purpose. That's the way it is. And
you chose the best candidates, and they happen to be women, right?
That's it. That's the way we do it. And this is very healthy.
Yes.
Very healthy.
I'm sure you've hired many people over the years, and you said that even the residents have come back to Harbor. Even if they left the county, they came right back. Why do you think that is?
I think that they come to work because it's a good place to work.
Yes, it is.
Why they put it in a simple, they are treated with a great deal of respect and consideration, and so that's it. And they like also the working for the underserved.
Yes.
That is very rewarding to me personally.
And you know what is very rewarding to a lot of the new people that are coming into the workforce? They want to make a difference. And working at the hospital or working in other departments within the county, we have the best thing going. We really do. Public service, I think, is one of the highest callings anyone could have. I believe that wholeheartedly.
I agree. To help people is what it's all about. And you help those who need help.
Yes.
And public service provides that opportunity.
If you can go back in time and tell your younger self, give your younger self some words of advice, what would you say?
Tell myself be ambitious from professionally.
Yes, yes.
And not politically, not professionally, to acquire more and more knowledge and be rewarded with whatever positions you acquire based on your merit and your knowledge. I work hard and concentrate in your job and your work, because it's a wonderful opportunity for you to help mankind and yourself.
Love that. I want to say thank you for your years of service with the county. Thank you for joining us here today. I have enjoyed our conversation. Thank you very much.
You're most welcome. I am delighted to meet you and to be with your team.
Thank you, Dr. Barajas.